Hi, this is part two. The other video cut off on me. So, as I was saying, it lasted longer and longer. So, I had my son call the paramedics again. This time, they didn't even ask me. It was a different set of guys, but they didn't even ask if I wanted to go to the ER. They said, "Well, we're gonna take you to the emergency room so you can be checked out." So they took me to the emergency room. Um, there, when the tests were ran, I guess it was so early on that all of the tests came back okay. EKG was fine, blood tests were fine. So the doctor, he just assumed that I had maybe acid reflux or GERD or something. So, they were giving me antacids, that type of thing while I was there. They did chest x-rays and all of that. Everything checked out fine. And so this was not my regular emergency room that of choice. This is where I had to go because it was closest to my home. So the initial ER doctor that I had saw, there was a shift change, so he was gone. So a new doctor came on staff. So they, of course, were ready to send me home because they had did their tests. They didn't find anything. But while I was still there, I had another episode. Now, when you go to the emergency room, you're in, these little rooms with the little curtains pulled or the glass doors pulled, all depending on what emergency room, what hospital you go to. So in any case, I'm in the room and I'm having another episode. I'm in there by myself. And because of the breathing, I wasn't able to yell out, and I don't know where the buzzer was to call for a nurse. So I had a brush, and I was throwing the brush out into into the hallway, trying to get somebody's attention. And I had a comb, and I threw the comb out there. So finally, a nurse came in, and she had quite the attitude, I will say. A lot of raise your hand if you've been in those emergency rooms. These people have attitudes where if it wasn't for patients like us, they wouldn't have a job. But in any case, that's something else. So anyway, she came in and she said, "Well, what is the problem? Why are you throwing things into the hallway?" And I'm, trying to catch my breath, and I'm telling her, I'm having the same issue that I had that I was brought in here for. I need somebody to check me out, what I'm saying, see what's going on. And so eventually, finally, the doctor on staff came in, and I told her, and she said, "Well, it's probably, the GERD or something acting up. Do you want me to prescribe you? Do you want me to give you more antacids?" And I said, "Well, no, because obviously what you giving me doesn't work. It's not working because I'm still having the same issue. You need to, check me out. Check, do some more checking, do some more extensive tests or something." And so, they didn't want to. She said, "Well, I don't know what you want me to do." And I said, "I just told you what I want you to do. I'm not the doctor here. I'm the patient, but I can relate to you what it is, I want you to do for me." And so she had, they just kind of were resistant. And, back to the fact that they were trying to send me home. Now, I couldn't walk because I was in the wheelchair. I had been taken to the emergency room, no wheelchair, nobody was there with me, and they wanted to send me home like in a cab or something. And I'm just like, "Look, I can't walk, I don't have a wheelchair, and you're not going to discharge me like that. I'm not, and I don't have anybody to pick me up." So in any case, they didn't want to do more tests, so I told them to transport me to my home, to my normal hospital. And so, they arranged ambulance transportation, and so they sent me to my emergency room hospital. So there, they had all my paperwork transferred over. But they ran all of their own tests all over again. It may have been some of the same tests, but they ran them all over again, and come to find out, in the blood, my troponin, it's called troponin, so my troponin levels were high. And I guess the troponin is a substance that leaks into your bloodstream if you're having an issue, issue with the heart. And so immediately they knew. And so the internal medicine doctor, she came in and talked to me, and she told me, okay, well, based on the tests, if it seems like there's a big issue, any type of issue with the heart, the cardiologist will come in here and talk to you. So I'm in my room. I'm like, the cardiologist. So I'm praying like, ooh, please don't let no cardiologist show up in my room, to talk to me, because that just is going to mean a whole nother story. And so, sure enough, here comes the cardiologist, and he tells me, well, maybe some kind of issue with your heart, and I advise that you do a test for I want to send you immediately, for angiogram. So immediately it was going to be like the very next early morning angiogram. He said, and then that way we can kill two birds with one stone. And if there is any type of a blockage there, while they're in there, checking the heart, they can fix the blockage. You know what I'm saying? We may have to put a stent in. And so my head is going in circles. I'm just like, what? A stent? An angiogram? Yeah, what in the world is all of this? And because time was of the essence, I didn't have a lot of time to do a lot of research. And so I had just agreed and gone with everything and let them do the angiogram, because I didn't want to be in any more trouble than I was already in. And so I went the next morning, had the angiogram, and I had a blockage in one of the arteries. And so it was, I think, 85% blockage, 85 or 95. I apologize. I don't remember which one, of the the left artery, left descending artery, I believe. And so they put a stent in. Pretty invasive type of procedure. But anyway, so I had the heart stent placed, and so from then on, I, went on this quest about finding different diets and things of that nature, to help with my, to help me with my heart, because what I have found through this was that my cholesterol levels were extremely high, and I have no idea why. I was asking questions. Well, what happened? What could cause my cholesterol to be so high to cause this? Was it over a long period of time? I was wondering, was it because of the autoimmune illness, because of the treatments that I was getting with the autoimmune illness? Just so many things, so many questions going through my mind. Was my thyroid's off? So just so many other things, and it just seems like they didn't really care to dig and find out. All they said was, I remember my cardiologist, he said, well, I'm just trying to save your life here, so you just need to take this aspirin, take these blood pressure pills, take this Plavix, and they prescribed a statin. Now, what I did do was start, doing some research about the whole statin situation. And so I opted not to take the statin. I wanted to do it through diet, and I wanted to, I just really wanted to get to the root of why the cholesterol was at that level, because I don't have a family history of heart disease. And so I wanted to get to the bottom of, why, what happened. Now, still haven't gotten to the bottom of it, because I haven't found a doctor yet, to help, help me get to the bottom of that issue. So Only thing I've been doing is, staying consistent with my physical therapy, my walking, and just staying positive, prayerful, just trying to keep my mind, away from negative things, negative energy, anything of that nature. And so that was my journey with that whole heart, disease. At the age of 47, about 47, yeah, at the age of 47, and having this heart attack. I know some people experience heart issues at a much younger age, but my body's already gone through enough with the neuromyelitis optica and the transverse myelitis. And then here I was in August 2017 with this heart issue. So, I tried my best to stay away from the doctor's office, but don't get me wrong, if I feel any kind of ailments, I will be the first one showing up in the emergency room. And I don't care what the chart says. They can call me a hypochondriac or whatever they want to label me as, but I'm there to be checked out. You're there to check me out. Again, without patients, they don't have a job. So, in any case, that is my story with the heart issue. And so I just want to tell those of you who have autoimmune illnesses or, heart issues, do your own research, be your own best advocate. Because if you don't speak up, the saying, the squeaky wheel gets the oil. So if you have to be that squeaky wheel, be that squeaky wheel. And sometimes it turns into a rabbit hole. You don't want to become too